Namaste, Jai Hind and welcome. I'm Prabha Narasimhan and welcome to this special edition of the Colgate Oral Health Movement. Oral health sits at the heart of well-being, and yet 9 in 10 Bharatiya face oral issues. And to stop that and to work on that, Colgate-Palmolive and Network 18 have come together along with the Indian Dental Association, and we've set out to turn awareness into action. We began the season with the Colgate MD and CEO Prabha Narasimhan charting the path and putting screening in people's hands with a dental screening tool on WhatsApp, followed by free consultations with IDA dentists. From oral health camps to kiosk activations across the country, it's been a movement built on participation. And in Delhi, the summit brought the momentum together. A message from the Union Health Minister Shri J.P. Nadda and thoughtful conversations on why Bharat's growth story must include oral health. Today, we are at the Mahamaya Inter-Girls College, representing schools across Bharat that shape everyday routines. We are here to make oral health a part of school day and every other day. I'm delighted to welcome Prabha Narasimhan, MD and CEO Colgate-Palmolive India. Prabha ji, namaste. My first question, generations of Colgate's legacy in Bharat, and how would you see a company, an entity that's been in Bharat even before Bharat in its current shape came through? And we talk about oral health today.
So thank you for the question, Anand. I think for us, Colgate has been in India now for the last 88 years. So well before Indian independence as well. And through its entire 88 years, it has been the leader in oral care. It's not unusual for you to hear moms telling their children, "Jaake Colgate karo," rather than "Jaake brush karo." And that's the legacy that all of us who work in the company today have inherited. And really what this means is it's our mission and our responsibility to drive and improve oral health in this country. And through the first 7-8 decades, this was about ensuring that every single household had a toothpaste and a toothbrush at home. Over the last 8 to 10 years, toothpaste, toothbrush have reached universal penetration, which means everybody has a toothpaste and a toothbrush. Now comes the hard task, because India's oral health habits certainly could be better from even the oral health movement data that we have received. And ensuring that Indians follow the 4 steps to better oral health is really something that we are very interested in. And these 4 steps, firstly, brush twice a day, so day and night. Secondly, brush for 2 minutes every time you brush. Thirdly, change your toothbrush every 3 months. And the last one, since your mouth is your gateway to your overall body's health, ensure that you're eating nutritious food. And these are the 4 steps that we talk about everywhere that we go, in all schools and under the aegis of our Bright Smiles, Bright Future program.
True, and these are the reasons, 4 reasons why we are here too. Have a look at it. It's there for them to imbibe and perhaps the start to habit formation. Meanwhile, the Bright Smiles, Bright Futures, or BSBF program, was recently conducted at this very school. Let's hear what some of the students and faculty have to say about it.
मैंने BSBF प्रोग्राम से ये सीखा कि हमें दिन में 2 बार ब्रश करना चाहिए और 2 मिनट ब्रश करना चाहिए, एक सुबह और एक रात में। और अगर हमने गलती से जंक फूड खा भी लिया तो हमें दांतों को अच्छे से साफ करना चाहिए।
हमें हर 3 मंथ्स में अपना पुराना ब्रश चेंज करना चाहिए, क्योंकि पुराने ब्रश में हज़ारों बैक्टीरिया जमा हो जाते हैं।
हमें दिन में 2 बार हमेशा ब्रश करना चाहिए और 2 मिनट तक धीरे धीरे अच्छे से ब्रश करना चाहिए, स्पेशली हमारे कॉर्नर के टीथ्स को, क्योंकि हम वहाँ पे ज़्यादा ध्यान नहीं देते हैं, जिसकी वजह से वहाँ पे ही जर्म्स बैठ जाते हैं और हमारे पूरे टीथ्स को ख़राब कर देते हैं कैविटी लगा के।
मैंने ये सीखा कि तंबाकू कितना हानिकारक होता है। तंबाकू हमारे दांतों और स्वास्थ्य में बहुत बुरा असर डालते हैं और मैं ये बात अपने परिवार में सबको समझा रही हूँ।
They learned not only the correct way of brushing, but why it is very important for us. And when they will share this knowledge to their families, it will create awareness among the whole community.
Around 600 students have participated there in the program. और जो एक आउटकम निकल के आया बच्चों का, वो बहुत ही पॉजिटिव हमें लगा। उन्हें पता चला कि वाई देयर इज़ अ नीड ऑफ 2 टाइम ब्रशिंग, वाई दे हैव टू गिव मोर फोकस ऑन ओरल हेल्थ केयर। तो आई थिंक ये जो कॉलगेट ने एक इनिशिएटिव लिया है, ब्राइट स्माइल्स ब्राइट फ्यूचर्स, इट विल बी वेरी वेरी बेनिफिशियल फॉर ऑल द किड्स ऑफ द country, and they will create more smiles, I think.
Oh, they've got such lovely things to say. But Prabhaji, you just talked about getting toothpaste and toothbrush into every household homes and penetration. But we are a large country. oral health seems neglected even now. Let's try and understand, given the spread of population, given the numbers, where is the problem? Is the problem on awareness? Is the problem access? Is the problem education? Where is the problem?
So I think maybe just let's go back to the Bright Smiles, Bright Future program that the students were referencing. And this program has been running in the country now for multiple decades. We've reached 185 million children with these basic tenets of oral health. But as you know, it's quite hard to move consumer behavior. And so if you wanted to narrow this down to where is the problem, I would say the problem is awareness, firstly, because I think people don't realize that better oral health is perhaps the simplest, easiest, most cost-effective way to better overall health, and it actually doesn't take up either a lot of time or a lot of money. The second is access to dentists. India has an access to dentists of about 1:10,000 in urban India and 1:50,000 in rural India. And it's a little bit of a chicken and egg problem because Indians only go to the dentist when they have a problem. And actually 1 out of 2 visits to a dentist leads to you actually losing your tooth, which is a real pity. And because Indians don't go to the dentist, even though we have the highest number of dental colleges anywhere in the world, and we have 30,000 dental graduates every year, it's not maybe lucrative enough for them to set up business and be practicing dentists. So there is both a problem of access as well as awareness. But as Colgate, we believe that awareness is actually the first step. If we can build this awareness of better oral health habits, many things will follow.
Yeah, because with awareness, then the next step is education and eventually access, because when people start asking for, then the dentist
Correct.
will also present themselves.
Absolutely, and everybody responds to market forces, and therefore we do expect that access will go up.
Absolutely. Then the Brush Tonight Sweet Tooth campaign. Now, it took a very simple yet powerful message and made it a national conversation. What was the inspiration behind it? I know the conversation that we are having itself lends itself to this, but tell us.
So Colgate does a lot of advertising. It's amongst the most advertised brands in the country. But this Sweet Tooth campaign has to rank right up there amongst my favorites for a couple of very simple reasons. Firstly, it takes an absolute truth. Most Indians go to sleep at night with sugar on their teeth because they finished with dessert, rather than toothpaste on their teeth. And the problem is that as you sleep, the saliva activity in your mouth drops. And when that drops, the defenses of your mouth are actually lowered. So brushing at night, really critical. So what Sweet Tooth did was to take that simple insight of don't sleep with sugar on your teeth, sleep instead with having brushed your teeth, because there's a proven link to reduction in cavities. 50% reduction in cavities if you brush your teeth at night, apart from a whole host of other benefits. And all it actually takes is that 2 minutes before you sleep.
Thank you, Prabhaji. And thank you to the students here at the Mahamaya Intergirls College for reminding us that oral health begins right in our schools. From here, we move on to the bigger picture. Back in the studio, we'll be looking at the big numbers on oral health across Bharat. Findings that have been brought together in the Transforming Smiles for a Brighter Tomorrow report by Colgate India. It's a comprehensive snapshot of where the nation stands today and what it will take to ensure a brighter, healthier future for every smile. So let's head back into the studio and explore these insights with Prabhaji herself. Stay tuned. We'll see you after the break. Welcome back. We've just heard from students about the importance of starting oral health early in schools. But to understand the scale of the challenge and the opportunity across Bharat, we need to look at the numbers. Colgate has put together a landmark report, Transforming Smiles for a Brighter Tomorrow. It captures insights from across the country, mapping out the risks, the habits and the behaviors shaping Bharat's oral health story. So Prabhaji is with us, so let's ask her and take this conversation forward. You've got to walk us through the numbers and what you've found because it's your study. But this book isn't just data on a page. It's a lot of insights and perhaps a reflection of the milestones from the oral health movement itself and the impact it has had on ground. What stood out to you the most from these findings?
So I think, Anand, thank you. If I start at the aggregate level, what stood out for me firstly was the overwhelming interest that we got from across the country. 4.5 million people actually took the oral health test to understand the state of their oral health. And that to me signifies the great hunger for knowledge in terms of how their oral health is doing. People were scanning for themselves, they were scanning for their children. Unsurprisingly, actually, we got a lot of feedback from the most populous parts of the country. But surprisingly, we even got feedback from places like the Northeast, which was really great for us.
So let's start with Uttar Pradesh, the most populous state in our country and also as good as a mini country in a country itself, 25 crore plus population. So what are your insights?
So unsurprisingly, Anand, we got a lot of scans from Uttar Pradesh. Actually, the maximum number of scans that we got were from Uttar Pradesh.
Okay, so let's call it up here on the graphic and also have a look at a deep dive as the number as you talk us through it. Yes.
Absolutely. So we got over 3 lakh scans from just Uttar Pradesh alone. 60,000 of which were done for children, either by their parents or children themselves. Nowadays, children are very, very tech savvy. This was the highest that we got from any Indian state. But while it was really encouraging that we got that much of a response, what was a little bit concerning was 2 things. One, parents were not aware of the oral health of their children. I think most parents expected that their children's oral health will be better than it was. And some numbers just to back up that point, about 55% of UP's children, 3 to 12 years, 55%, are actually at high risk of cavities.
Cavities, and that too 3 to 12 years.
Correct.
So the formative years of your doodh ke daant and then the permanent teeth also come around this time. Yeah.
And you've hit upon absolutely the right point, which is that if you have a cavity in your milk tooth, the likelihood of your having a cavity in the same permanent tooth actually triples.
Wow.
So while you can imagine that, okay, the tooth will fall and it doesn't matter, it does actually matter. So that was one. The second, 13 to 17-year-olds themselves, 30% of them claimed that they had had incidents of tooth pain. And anybody who suffered from tooth pain will know that that's not a pleasurable thing at all.
Okay.
So in response to this, maybe I can also talk through the positive.
Yeah, the BSBF.
Exactly. Of what is Colgate doing about this. Last year, we had the privilege of partnering with the UP government, the education department, to get access to all of UP's schools and all of the children who study in those schools. Since the time that we've had that access, we have covered 60 lakh children with the Bright Smiles, Bright Future program across 39 districts. And we intend in the next couple of years actually to cover all of them. No mean task in a state
Not
the
at all,
size
and
of UP.
we've positively impacted 60 lakh plus children since 2024. That itself is a significant number, so pat on the back for that. And what about the Anganwadi workers?
So it's not just enough for us to only cover the schools, though children are the harbingers of change. We've also talked to a partnership with the Anganwadi workers, which is also kicking off. We kicked that off in Ayodhya actually very, very recently. And we will have Anganwadi workers across 2,300 centers, also taking out the oral health message across UP.
So fantastic. So a lot of work that's happening all across Uttar Pradesh. My next question is also about, before we go back to the study and the numbers, we know this sugar boards which have come in, health boards, and I know Revant very well, who's worked on it as a movement. What about oral health boards? Is that a possibility?
I think it's a fabulous idea, and we would love to partner with any schools that want to set up an oral health board. And in fact, we'd love to partner with CBSE, ICSE, any of the boards that run to set up these, because as a parent, I can tell you that I want my children to have great oral health. As a parent, I can also tell you stopping children from eating any kind of sugar is near impossible, at least with my children.
Yeah.
So I would love for oral health actually to be the corollary to moderation in eating of sweets, because it can never be zero, coupled with great oral health. So if we can put these boards side by side, I think that would be tremendous.
So now let's do, I'm a South Indian, and I'm born in Kerala. So let's try and understand if you did a deep dive around my own personal home district. So you talked about Uttar Pradesh. So if you can understand Thrissur. I'm born in Thrissur. Thrissur is one of the central districts, the 3rd biggest city in Kerala itself. So what are the information on Kerala? Let's call that out also. Hanji.
Okay, so as the information comes up, we had 1,600 scans from just Thrissur alone.
Thrissur, yeah.
So a well-represented population and probably the best oral health data that exists,
really?
if I may say. Unfortunately, again, 51% of these 1,600 people actually at high risk of cavities. And this is higher than the national average, which is 41%. Absolutely. 40% of people in Thrissur at high risk of gum disease versus the Kerala average itself of 32%. So clearly there's something that people in your hometown could do better.
How much of this a factor? 50% people have tea, coffee twice or more in a day.
We've actually realized that tea, coffee, soft drinks, the presence of diabetes, many of these are actually markers to poorer oral health. And so if you are a tea, coffee drinker, you are a tobacco chewer or smoker, or you have a lot of soft drinks, our data indicates that your oral health actually drops off quite sharply and you are at a much higher risk of oral health problems.
Okay, so let's just quickly move to some of the bigger metropolitan cities. Mumbai, for example. Okay, you ply your wares between Mumbai and Chennai. We are speaking somewhere in Delhi, NCR, and Noida. These are the metropolitans. Is there a difference between urban, cosmopolitan, urban, and perhaps rural areas? What data did you see? Let's talk Maharashtra, Ji.
So from your home to ours, we move from Kerala to Maharashtra. 91,000 scans across the state. 18,000 of those were within Mumbai and its suburbs. The state has a fairly high risk of gums and cavity issues. And if you're hearing me repeat this quite often, it's unfortunately because a lot of India actually is at high risk of gum and cavity issues and we just don't realize it. Yeah. And the suburbs are unfortunately higher than the state average.
Okay.
And the contributors, like we discussed, are things like tobacco usage and diabetes.
So 47% in Mumbai suburbs vis-a-vis the state average of 40%. And like you again said, lots of tobacco usage, tea, coffee drinking, all of that contributes to the health.
Absolutely. But because I've given you so many of this is a problem, that is a problem, and that is a problem. If I could drill down to where our office is located.
That's Powai.
Yes.
So you spoke Thrissur, my home district. So let's talk about your corporate office.
Now I'm going to bring it right
so
down
how are you
to
doing
where
in Powai?
our office is located. So firstly, starting with the aggregate score against a national average of 2.6 out of 5 as an aggregate score, Powai is at 4.1.
Wow.
I want to believe it is our presence that makes the oral health of Powai that much better. But having said that, I think more importantly, if we can have geographies like Powai that have such good oral health, why can't we have the whole country?
Since your plant operations are based in Powai, I would assume a large part of your workforce also lives around there. So at least in corporate health, corporate habits, it's inculcated among the Colgate-Palmolive lot that you need to brush twice. Yeah.
Absolutely, and you're seeing the straight corollary between the better habits and the better outcomes.
Correct.
Because in Powai, only 14% of people are at high risk of cavities. We've been discussing numbers in the 40s so far. And more than 50% of people claim to brush twice a day, which is way higher than the national average of 20 in urban India.
If that's possible in Powai, why can't it happen in the rest of the country?
This is exactly why the oral health movement. This is where we are trying to build the awareness of how critical it is and how actually you can make a meaningful difference by just these simple habit changes.
So if Powai can, why can't you? When it comes to oral health, how do the Northeast numbers look like?
So firstly, we were really encouraged by the number of people who participated in the Northeast. I started by saying that we weren't expecting such a response. We got 32,000 scans across the 8 states. In the Northeast, actually 30% are at risk at high stains. This is a new data point because obviously you want a nice, white, bright smile. And staining is the other element of oral health which needs to be addressed. Once again, tea, coffee, a big contributor, as you would logically imagine.
And supari and the
supari, tobacco, also a big contributor. You're absolutely right. And what was even more scary though in Northeast, 63% of people in Arunachal Pradesh at risk of cavities.
One of the issues which we are now currently facing all around us, and there's an AIM study about it, is also about cancer, the link between oral health and also greater cancer risk. So what is it that we can do and what is it that you as Colgate-Palmolive are trying to do?
We're really happy that people like AIMS are doing these large-scale studies that they have done. We have this large-scale data. We would love to partner with them to make sure that we are taking this forward into more actionable ideas and outcomes.
Most importantly, we've got to talk about the Colgate Bright Smiles, Bright Futures, or the BSPF. Now, when you've taken BSPF into various states, we spoke about Uttar Pradesh. How has the response been? Has there been a positive uptake to your campaign?
This is a fundamental flagship program of the country. It has been running multi-decades, actually, long before CSR was a thing. The Bright Smiles, Bright Future program ran. Unsurprisingly, it is the center of our CSR strategy as Colgate-Palmolive because it sits squarely in our mission of driving better oral health for the country. We've reached 185 million children in its lifetime. We did about 10 million children just over the last year, and we intend to keep scaling this up as we go forward. We're fortunate enough to have many state governments partner with us. We already discussed the partnership in Uttar Pradesh. We have a partnership in Goa. We have a partnership in Andhra Pradesh. We have a partnership in Assam. We have a partnership in Maharashtra. And we would love to partner with any other state governments to do the same. The second leg of what we are doing, and if I can maybe expand your question to the more, the basics of what we are doing, is to give people access to technology. The oral health movement and the scan, the photo scan.
Yeah, the WhatsApp scan,
Exactly.
It was using tech to do something very simple. You don't even need to go to the dentist, just do it on your phone,
Absolutely, and the minute you put it in the hands of consumers, you see the kind of response that you get because there is certainly interest there. And then we talked about the Anganwadi workers in Uttar Pradesh. In addition to that, we have just recently, and this is hot off the press, done a partnership with the Trained Nurses Association of India. Many people, of course, rely on these very committed individuals for their health information. And so this is now going to become one more channel through which we can disseminate oral health information.
What do you think we as Indians need to do so that this entire score improves, especially on oral health?
So I think if I could maybe go back to my school teacher status of giving the data and talk about the fact that only 9% of India scored a 5 on 5. As a parent, I'm constantly pushing my children that if you've got 95 in an exam, where is the remaining 5? So it would be fantastic if we could get India towards moving towards the full centum or the 5 on 5 score.
Not 9, but 90%. That's what we need to do.
That would be amazing if we could do that. Like you've already pointed out and like I've said, but it bears repeating, so I'm going to say it again. 2 minutes a day, twice a day, under 2 rupees cost. If we can all take the pledge to do it for the next 2 weeks, I think that would be a tremendous outcome. And it would be fantastic if we can ration the products that impact your oral health. I know products like particularly soft drinks and sweets, and I know I can't control my children to make it zero, but moderated impact of those along with great oral health, I think could lead to the kind of outcomes that we want.
And stay away from tobacco and drink as little of coffee and tea as you can. Within all of that. But most importantly, before you go to bed, brush your teeth. Prabha ji, thank you so much.
Thank you very much. It's been a pleasure.
The message is clear. Oral health is the foundation of a brighter future. The show ends here, but the movement continues. And we'll be back soon with more stories, more insights, and more smiles. Until then, keep brushing, keep smiling. I'm Anand Narasimhan, and thank you. Thank you for joining us.